Welcome to the CHC podcast. I'm your host, Julie Fisk. Today, we're going to talk about information technology strategy with Brian Doerr, CHC's Senior Vice President of Information Technology and Security and Privacy Officer. So, Brian, what are some common IT challenges you see for rural and community hospitals?
Sure. I kind of feel like they fall into four categories. There's financial, there's technology, there's staffing, and then there's security, right? They have a lot of security risk being small facilities. They don't have the resources of a large urban facility. Related to staffing, they're always challenged finding talented people that want to work in rural communities. So we always see a lot of staffing challenges, not just recruitment, but then retention, because many IT people can work remotely these days. In terms of technology, I would say their tech debt, the antiquated systems that they still maintain because for whatever reason they can't afford it, they don't have the team to upgrade it, to add new technology that can replace that technology. There's a lot of debt that is sitting there, just sitting in the closet, something we'd like to push into the closet. And then obviously financial, rural facilities have a real challenge managing the financial aspect of the entire business to take care of their community, their patients, and IT is just one component of that. So they really struggle trying to prioritize IT investment over something like a new MRI for their community.
I mean, that's a lot of big challenges. So what would CHC recommend to address all of that?
Sure. I think from CHC's perspective, we look at it strategically. We look at how do we build a plan for that rural community hospital that they can execute on, that is manageable for a facility their size. And it's very dependent on where they're at now and what they're doing, where they want to go, and what their overall vision is for their business and their community.
You've mentioned strategy before. Can you tell me what a strategic approach to IT looks like for a community or a rural hospital?
So a strategic plan for a community hospital is really about aligning the IT plans with the business objectives and the mission and the vision. Many facilities have an overall business strategy that they're executing, but many times they look very tactically at IT and say, I need printers fixed, I need computers replaced, but they're not thinking about how IT can be a strategic business partner in building their community's healthcare infrastructure. So it may be that they're fixing a printer or a computer, but is that really driving value for that organization? Should they rather be working on replacing a PACS system or improving wireless connectivity throughout the organization so that as people are moving around from care setting to care setting, there's just seamless technology. So it's really about building a plan that addresses whatever the needs are of that organization and really understanding where you're at today to get there.
So why is it especially important for rural and community hospitals to take this type of approach?
Sure. Many times, executive teams, the board, the community doesn't really understand what IT's value can be for the organization. So building a plan and communicating and educating everybody on that plan is one really critical component, right? Making sure that everybody is aligned, that IT is working on what they need to do to bring value to that organization. And then having a plan allows everybody to assess where are we today and what are the steps so that we have accountability of that plan, so that we make sure that everything that we're doing is kind of really driving to that end goal that is in that plan. And we typically look at that as saying, let's take a 3-year approach to that. So when we look at it, we'll say, okay, what do we need to do now? But what are we looking at in the future? So we're not just sitting there talking about today, we're really talking about how does today bring value to tomorrow and the next day and the next day. And then we're always continuing evaluating that plan to make sure we don't need to change some direction or realign something.
Well, what would the first step be in creating a strategic IT plan?
So the first thing that you need to do is assess where you are today. So we call that an IT assessment, and we'll walk in and we'll look at not only your technology, but you also have to think about all of the things around that. the people, and the processes related to that. Because technology, while we want to think technology is the answer, it's a component of the answer. And it really takes, invested people and processes that are effective and efficient to make it work. So we look at all of that to manage risk, to look at the finances, right? And then to build a plan for that facility that really addresses exactly where they are today. But that is the first step. And a lot of times when we walk into facilities, we've seen somebody in the executive team that has seen something out in the market, a salesperson, a vendor, they've been to a conference and they've seen these bright, shiny objects that are really fancy and have fantastic dashboards. And wow, are they whiz-bangy? But they really don't drive the value that they're looking for. So a lot of times it's not only assessing that, but then aligning that and making sure that we're not focused on those things, but we're really focused on what brings value to our community and to our organization.
So resource constraints are a real issue for rural and community hospitals. How does that factor into a strategic IT approach?
Yeah. So as we look at the plan that we develop, we look at all of the resources, right? We talk about people, we've talked about financial resources, we've talked about community resources, and we have to kind of map that out in the plan. A lot of times, everybody wants to get to the end. Everybody's like, what do I need to do to get to here? And they want to jump to the end. So many times when we're looking at a community hospital or a rural hospital, we're saying, what do I need to get on the path to create a roadmap that gets them from here to there, but doesn't, everything doesn't have to happen in one day or 1 month or 1 year. So a lot of times what we're looking for as we do that is to align with finance, align with HR, look at those resources, look at external resources if we need to, and build a plan that we start to get them on the path so that we can see value. We look for the highest value opportunity, the lowest hanging fruit, so that we can jump in that, show people that there's value in IT. Oh, wow, we fixed something that's been a problem for the last 10 years. We fixed that. And now you've got people that are on your side and they're like, well, let's go do more. And now you've got a year over year approach that you can get to where you want to get to. It's just, let's build something that's practical, reasonable, and can work in a resource constrained environment.
Well, how do partners and vendors play into that?
Yeah, so we've talked so much about resource constraints. Many times you can't find those resources. So we look for partners, vendors, outsourcing opportunities where it's applicable. We want to leave as much of the institutional knowledge in that community as possible, right? But that's about how we take care of people. How do we take care of our friends and neighbors? But what we're looking at is how do we leverage the resources we need to do that most efficiently, most effectively. So many times we'll bring in a virtual CIO or virtual networking people or virtual system administrators, fractional people, so that a facility doesn't have to spend all of their resources on a single FTE and make them do everything under the sun. We can find the specific people that have the expertise, have extreme knowledge, and you use them just as much as you need to. We also look for grant opportunities, right? We look for external ways that the government helps rural and community hospitals, like our USAC program, where we help hospitals across the country get funding for telecom services to bring that cost down, because rural telecom costs are much higher than in urban areas. So looking for those resources, whether it's grants, whether it's partnerships, whether it's virtual people, just trying to build a plan and not saying everything has to be here. The things that need to be here are, I need to take care of my patients. I need to have the clinical expertise here. But all of those support services, we build a plan that works for that facility, and it really makes sense for that facility and that community.
That sounds like a big project. How can hospitals get started right now?
Yeah, it's really about making a decision that you want to move down this path of a strategic planning process, not just for IT, but for your organization. Once you do that, it's a very simple exercise. It takes work. It's not, we have to go out and we have to dig into all of your systems. I will tell you, most organizations we walk into, we find systems nobody knew about. that are still running, still active, and still creating risk for that organization and cost for that organization. So the first step is really taking that IT assessment step and getting an understanding of where you sit today. You may find that you can reduce your spend on IT dramatically just by doing that assessment and figuring out what are those things that I really don't need to be doing today. And then you can begin to build that plan, educate your team, bring the team into the conversation and figure out what are our next steps to build that roadmap and that strategic plan. But the first step is really taking that new mindset approach of let me figure out where I'm at and let me build a strategic plan and not just think today about what's happening today.
Have you worked with any hospitals that have been successful using this approach?
Yeah, I think there's a hospital in Texas, Freestone Medical Center in Fairfield, Texas, that is a great example of taking this approach and being very successful with it. We came in the door and they were really struggling with a lot of tech debt and a lot of expense, and they had a lot of priorities. So the first thing we did was an IT assessment. We looked at everything they had, what they needed, and what they were trying to do was expand some clinic sites and expand some services at the hospital, and they couldn't afford to do that and invest in a dilapidated old infrastructure that they had to replace in IT. So we assessed that, we built a plan, we looked at it, and then we said, you know, there's a lot of new technologies, cloud infrastructure, so that rather than using a lot of CapEx dollars to go out and buy big iron that sits in your hospital and ages like a car when it walks off of a lot, we could invest operational dollars in cloud services. We could reduce that expense dramatically and say, we don't have to replace all these servers, let's just move them to the cloud. Let's rationalize the systems that we have. Let's minimize that. And in doing that, we saved them over $500,000 that they could then take and invest in those community centers and those clinics that they wanted to invest in. So been a tremendous success. Took multiple years to do that. And I will tell you, you could talk to their IT director. It took a little while to get him on board with that plan. He was used to managing blinking lights in a server room, and all of a sudden it's managing an internet connection and then looking at dashboards on your screen about what's happening in the cloud. But you talk to him today, I would tell you he's a raving fan.
So what's the biggest risk to staying with the status quo?
Well, when you think about the status quo, what happens so many times is that organizations don't invest in IT, and that cost of not investing grows and grows, and your risk grows. So not only is there a financial concern and a financial risk, but from a security perspective, as technology ages, they receive less and less updates. We've walked into facilities where they're not HIPAA compliant because their technology is not supported any longer. So then you create organizational risk from not just a compliance. Compliance is very important, but we're not focused on compliance. The reason there's that compliance is that security and privacy measures for not only your organization, but your patients become at risk if you're not updating and managing your technology. So not moving on something like this creates organizational risk. We have seen so many hospitals in the last decade that haven't invested in technology and security and the processes and the people, and all of a sudden they get hit with a ransomware attack. And they take not just IT down, but IT is everywhere in a hospital now. So it takes the entire organization down. And now we're worried about the viability of that facility from a long-term perspective. So I would tell you, I think the biggest risk is not moving. Do something, because if you're not moving, you are falling back. You really need to be pushing on this, even if it's in small steps, because you don't have the resources. Just get on the path.
Well, thank you, Brian Doerr. You brought so much valuable information to us today.
My pleasure. Thank you for having me.